Welcome to the City of Houston. During today's benefits presentation, I will hit the high points of your City of Houston benefits. All full-time and part-time employees who work an average of 30 hours per week or more are eligible to participate in the City of Houston benefits plan offerings. Temp employees are not eligible for benefits. The City of Houston offers the following benefits: medical, dental, vision, flexible spending accounts, supplemental insurance plans, basic and voluntary life insurance. Today's presentation is just a brief overview of your benefits. For more information, visit cityofhoustonbenefits.org. There you'll find benefits guides, detailed plan information, presentations and benefits education videos, wellness information, forms, and more. As employees, you will enroll using the Employee Self-Service Portal at portal.houstontx.gov. If you need to reset your ESS password, contact HITS at 832-393-4487 or visit houstontx.service-now.com. Once you are logged into ESS, choose My Benefits from the ESS tab at the top of the screen. Under Benefits Enrollment, choose Anytime Changes. This will open the enrollment form. Complete the form within 30 days of your hire date. Benefits are effective either on the 1st or 16th day of the month following 30 days of hire date. Your eligible dependents include a legal spouse, natural, adopted, or stepchildren up to age 26, children up to age 26 over whom you have legal guardianship or legal foster care, grandchildren up to age 26 if they qualify as your dependent for federal income tax purposes and live with you. Ex-spouses are not considered eligible dependents unless a court order has been issued that states they need to be covered on your health plans. Step-grandchildren are not considered eligible. Other eligible dependents include disabled dependents over age 26. In order to qualify, the dependent must depend on you for more than 50% of financial support, must be classified as disabled and covered on a medical plan before reaching age 26 and approved for coverage after age 26. If you have a dependent for whom a court order has been issued requiring you to provide healthcare coverage, you must provide benefits the court order within 31 days of the event. In all situations, the plan's eligibility rules and necessary documentation apply. The City of Houston requires that employees submit appropriate documents for eligible dependents to be covered on health plans. The city requires proof of identity such as a Social Security number or TIN, and proof of eligibility such as a birth certificate, marriage certificate, or legal adoption paperwork. Please be advised that you also need to provide all the dependents' Social Security numbers and dates of birth to enroll. The list of required documents is available at cityofhoustonbenefits.org. If you are covering any dependents, you must submit your supporting document within 30 days of your hire date. If you miss this window, your next opportunity will be during open enrollment, which occurs in March each year, or if you have a qualified life event. You can submit supporting documents through the Secure Document Submission portal at bit.ly/COH-benefits form, or you can bring them in person to the 611 Walker 4th floor lobby drop box. If both you and your spouse work for the City of Houston, you may be covered as an employee or as a dependent, but not both. Dependents may be enrolled under only one parent or guardian if both parents work for the city. Outside of open enrollment, the only other time you can make a change is if you experience a qualifying life event. A qualifying life event is a change in your situation that makes you eligible to enroll or change your health benefits. Some of the most common qualifying life events are marriage, birth or adoption of a child, divorce, loss of other coverage, and moving outside the coverage area. You are responsible for notifying the Benefits Division of a qualifying life event within 31 days of occurrence. If you wait until after 31 days, you lose the ability to enroll or make changes until the next open enrollment. The City of Houston offers 3 Cigna medical plans for our eligible active employees: a consumer-driven health plan, or CDHP, a limited network plan, similar to an HMO, and an open access plan, or OAP. Let's talk about how these plans differ. CDHP offers a low paycheck contribution and includes a health reimbursement account to help you lower the cost for services. The city pays for the first $500 for an individual or $1,000 for family to the HRA, which can be used to offset your deductible or co-insurance cost. Under the CDHP, you have access to all Cigna providers throughout the country without having to seek referrals to see specialists. There are no copays on this plan, meaning that you will pay 20% of the cost of your doctor's visits, hospital stays, lab work, x-rays, emergency room visits, and outpatient procedures when you stay in-network after you reach your annual deductible. The annual deductible on this plan is $1,750 for an individual and $3,500 for family coverage. Remember that these deductibles are offset by the HRA. This plan also includes a 4-tier prescription drug plan. You'll pay 20% co-insurance on covered medications. Please take a moment to review the bi-weekly rates on the screen. These include discounts for tobacco users and participation in the annual wellness program. The limited network plan allows you to choose from 3 provider groups: Kelsey-Seybold, Renaissance, and Village Family Practice. This means that you need to coordinate your care within these networks. In the limited network plan, you have a lower deductible and pay less for your services. The limited plan has a $200 annual deductible for individuals and a $600 annual deductible for family. Additionally, you have set copays for services like primary care and specialist visits, outpatient surgery, inpatient facilities, ER, urgent care, and more. The limited plan does not offer a health reimbursement account, so the city is not contributing towards the cost of services like the CDHP. If you choose to enroll in the Village Family Practice or Renaissance Network, you must choose a primary care physician and you need a referral from your PCP in order to see a specialist. At the time of enrollment, a PCP will be assigned to you based on your zip code. When you receive the insurance card in the mail, please contact Cigna directly to update to a provider of your choice. If you choose to enroll in the Kelsey-Seybold network, you do not need to choose a primary care physician. With Kelsey-Seybold, you can visit any Kelsey-Seybold office in the Houston area, and you do not need a referral to see a specialist with Kelsey. You and your dependents do not need to be enrolled in the same network. Please take a moment to review the bi-weekly rates on the screen. These include discounts for non-tobacco users and participation in the annual wellness program. Open Access Plan, or OAP, is the most expensive plan in terms of paycheck amounts. However, it gives you greater flexibility to choose your care than the other 2 plans. The OAP gives you access to Cigna's national network without a need for referrals to see specialists. OAP has an annual deductible of $850 for an individual and $1,700 for a family. Once you have met this annual deductible, you will pay 30% co-insurance for most services until you reach your maximum out-of-pocket. You will have a set copay for primary and specialist care visits. The OAP includes a 4-tier prescription plan with no deductible to meet. Please take a moment to review the bi-weekly rates on the screen. These include discounts for non-tobacco users and participation in the annual wellness program. The 3 medical plans had differing copayments and coinsurance amounts for prescription coverage. The CDHP has a prescription deductible that is combined with your medical deductible of $1,750 for an individual and $3,500 for a family. On the CDHP, you will pay 20% of the cost of the drug for all drug tiers. The limited plan has a separate prescription deductible from the medical deductible, so this is an additional amount you will need to pay exclusively for prescriptions. The limited plan offers tiered copay amounts for different classifications. The OAP does not have a prescription deductible and offers tiered copay and coinsurance amount for different drug classifications. Please review the cost of prescription drugs by verifying which tier your prescription fall under and carefully consider your options when choosing your medical plan. 90-day prescriptions have a higher copay or coinsurance than 30-day prescriptions. Specialty drugs in the limited and open access plans are available only as 30-day prescriptions. You can save money on your 90-day prescriptions by choosing Cigna Express Scripts. You'll pay just 2.5 times your retail copay for a 90-day prescription, which can save several $100s a year depending on your usage. There are over 68,000 retail pharmacies in your network, which include local pharmacies, grocery stores, retail chains, and wholesale warehouse stores, all places where you may already shop. 30-day prescriptions can be filled at any retail pharmacy in the plan's network, including CVS, H-E-B, Kelsey, Kroger, Walmart, and Walgreens. For 90-day prescriptions, you have the option to use a 90-day retail pharmacy in the plan's network. These include CVS, Target, Kroger, Walmart, or you can use Cigna Express Scripts. Visit mycigna.com for a complete list of in-network pharmacies. Pharmacies in which you can fill a 90-day prescription will be identified with a 90 symbol. Cigna has partnered with Cigna Express Scripts to offer savings on many generic and brand name drugs through mail order. Signing up for Cigna Express Scripts is easy and convenient with your prescriptions shipping to your home for free. Covered medications include generic and brand name asthma medications, generic cardiovascular and high blood pressure medications, generic cholesterol medications, generic diabetic medications, preferred brand diabetic test strips, and brand name insulin. Additionally, if you are a member that is not enrolled in Medicare, you are eligible for a free diabetic blood glucose meter. Call Cigna Express Scripts at 1-800-835-3784 to get started. The City of Houston is excited to offer 2 Cigna dental plans for eligible employees. You have the option to choose between the Cigna Dental Care DHMO plan and the Total Cigna DPPO plan. The Cigna Dental Care DHMO plan is a cost-effective plan that has fixed copays for dental services with no deductibles or annual maximums on services. You will need to select a primary care dentist and will need a referral to see specialist. The service area includes all of the United States except for 13 states. Benefits start on May 1st. There is no waiting period. You will not have to submit claim forms on this plan unless you choose to use services out of network. There is no charge for preventive services on this plan and fixed copays for basic and major services. If you enroll in this plan, Cigna Dental will automatically assign a primary care dentist based on your zip code. Once you receive your dental ID card, you may contact Cigna Dental to change to an approved provider of your choice. For more information, visit cityofhoustonbenefits.org. The Total Cigna DPPO plan gives you the freedom to visit any licensed dentist or specialist. No specialty referrals required. The plan will cover eligible dental expenses after you satisfy any applicable waiting periods and meet any deductibles. The annual deductible is $50 per individual and $150 per family. The annual maximum benefit for Class 1, 2, and 3 expenses is $2,000. The plan is based on coinsurance levels that determine the percentage of costs covered by the plan for different types of services. For example, Class 1 expenses are preventive services like cleanings and certain x-rays and are covered at 100% by the plan. Class 2 expenses are basic services like extractions and root canals and are covered by the plan at 80%. Class 3 expenses are major services like bridge work and crowns and are covered at 50%. Did you know that eye health is an important component of your overall health? Eye exams can detect chronic issues including hypertension, autoimmune disorders, cancer, and thyroid disease. With the Vision Plan, there are no annual deductibles, just simple copays when you use the services. You will pay $20 for your routine eye exam and $25 for your glasses or contact lenses. The $25 eyewear benefit includes a $150 allowance toward your glasses or contacts, including single vision, bifocal, trifocal, lenticular, progressives, high index, and polycarbonate lenses. Additionally, if you are thinking about laser eye surgery, the Vision Plan offers a one-time $300 credit toward LASIK. Superior Vision offers many providers to visit for your eye care needs, including EyeMasters, VisionWorks, Target, Sam's Club, Today's Vision, Walmart, Vision Source, and many others. To see a complete list of providers in the network, visit superiorvision.com. The City of Houston offers 2 options for flexible spending accounts. The Healthcare Flexible Spending Account, or HFSA, for health-related expenses, and the Dependent Care Reimbursement Plan, or DCRP, for dependent care expenses. The provider is Total Administrative Services Corporation, or TASC. The plan year for the HFSA is May through April, and for the DCRP is January through December. The HFSA is a voluntary pre-tax benefit plan that allows you to set aside money from your paycheck to be used to pay the out-of-pocket medical, prescription, dental, and vision expenses that you or your eligible dependents incur. The DCRP is a pre-tax benefit account that can be used to pay for dependent care services like preschool, summer day camp, before and after school programs, and child or elder daycare services. How does the HFSA work? You'll select an annual amount to contribute. As a new hire, this amount will be divided among the remaining pay periods in the plan year. The closer you are to the plan year end on April 30th, the less pay periods there are to divide the total amount by. Your biweekly amount will be calculated in ESS. Be sure to review this amount before submitting your election. The minimum and annual amount that you can contribute to a plan is $240, and the maximum is $2,550. There is a $500 rollover into the next plan year, but any amount over that will be forfeited. After you enroll, you will receive a Task MasterCard in the mail. Use it like a debit card at your doctor's office, pharmacy, and more to pay for qualified expenses. You have 90 days after the plan year ends on April 30th to file claims for Task for any expenses you weren't able to use the Task card to pay for. In addition to copays, coinsurance, and deductibles for medical, dental, and vision services, you can also use your HFSA for chiropractor visits, to pay for eyeglasses and contact lenses, LASIK surgery, bandages, first aid kits, hearing aids, medical equipment, lab fees, diagnostic services, and hospital services and fees. For more information, visit cityofhoustonbenefits.org. Here are some highlights on the DCRP. The dependent care expenses must be work-related. The care must be necessary for you or your spouse to work, to look for work, or to attend school full-time. The dependent care expenses provided during a calendar year cannot exceed $5,000. You'll select an annual amount to contribute. As a new hire, this amount will be divided among the remaining pay periods in the plan year. The closer you are to plan year end on December 31st, the less pay periods there are to divide the total amount by. Your biweekly amount will be calculated in ESS. Be sure to review this amount before submitting your election. Dependent care expenses must be for the care of one or more qualified persons. A qualifying person is defined as one of the following. Dependent care expenses must be for the care of one or more qualifying persons. A qualifying person is defined as one of the following. A dependent child who was under the age of 14 when care was provided and for whom a tax exemption can be made. A spouse who is physically or mentally unable to care for themselves and live with you for more than half the year. A dependent who was physically or mentally unable to care for themselves and for whom an exemption can be claimed and lived with you for more than half the year. Some examples of eligible expenses for DCRP are fees for a licensed daycare or adult care facilities, before and after school programs for dependents under age 14, amounts paid for services including babysitters or nursery school provided in or outside your home, nanny expenses attributed to dependent care, nursery or preschool fees, summer day camp if the primary purpose is custodial care and not educational in nature. The City of Houston provides a basic life insurance policy for each eligible employee that is equal to your base salary at no cost to the employee. You do not need to do anything to qualify for the basic life insurance policy. It is automatically provided by the city. Please be sure to add your beneficiaries in ESS. Your spouse is eligible for a $2,000 basic life insurance benefit, and dependent children for $1,000 after you enroll them in ESS. You have the option to purchase voluntary life insurance for yourself up to 4 times your annual base salary. As a new employee, you must enroll within 30 days of new hire and are guaranteed issue up to 3 times your annual base salary. Guaranteed issue means that you do not have to answer any medical questions or submit an evidence of insurability form to get coverage. If you are electing 4 times your base salary, you will need to submit an evidence of insurability form. You may also purchase additional life insurance on your dependents. Your spouse can carry up to half your annual salary, up to $50,000. Additionally, you can cover your children for $10,000. Premiums are calculated based on age, salary, and coverage amount chosen, so you can review the rates when you log into ESS to select your benefits. The voluntary life insurance is a post-tax benefit, which means you can elect, increase, decrease, or cancel your coverage at any time. If you are electing or increasing your life insurance coverage after your first 30 days of hire, you will need to submit an evidence of insurability form. Life insurance is not always so simple. Life insurance benefits cannot be paid to anyone under the age of 18 without legal financial guardianship documents on file with the courts. If you are interested in naming someone under the age of 18 as your beneficiary, you must have proper legal documents drafted that allows them to access the money. Otherwise, the funds will go into a trust until they reach age 18. If you experience any major life changes such as marriage, divorce, birth of a child, or death of a loved one, we strongly encourage you to update your beneficiaries with the Benefits Division. You can update your beneficiaries at any time. When you list your beneficiaries, remember, the primary beneficiaries are those that will absolutely receive the money you listed. Contingent beneficiaries will only receive the life insurance funds if the primary beneficiary has also passed away. If you have elected life insurance for your dependents, you are the only beneficiary on those plans. The City of Houston supplemental insurance offerings are provided by a Continental American insurance company and include group hospital indemnity, group critical illness with cancer, and group accident insurance. They will help protect you and your family against unexpected costs due to medical conditions and hospitalization. Individual and family supplemental coverage may be a good fit for some employees who want extra financial protection. The Hospital Indemnity Plan covers the costs associated with hospital visits and surgical procedures. This plan reimburses you after you file a claim, which can help lower the out-of-pocket expenses associated with unexpected medical conditions and hospitalizations. The plan includes a $100 per day benefit for ICU stays up to 30 days, a one-time hospital admission benefit of $500, a $150 a day benefit for hospital room confinement up to 30 days, a $125 benefit for outpatient surgery, and a $50 benefit for health screenings. This is not an all-inclusive list, and some exclusions or limitations can apply. For more information, visit the Benefits Division website at cityofhoustonbenefits.org. The Group Critical Illness Plan pays a lump sum benefit if you are diagnosed with an approved major occurrence, including cancer. You can receive up to a $20,000 lump sum payment paid directly to you upon diagnosis of cancer, heart attack, stroke, coma, major organ transplant, kidney failure, burns, and more. Additionally, you can receive a lump sum for reoccurrence benefits, so long as they are 6 or 12 months from the original occurrence. This is not an exhaustive list of covered occurrences, and some exclusions or limitations can apply. Please refer to the plan documents on the Benefits Division website for more details. Accident insurance covers the cost of expenses due to an accident, such as ambulance rides, emergency room visits, surgery and anesthesia, prescriptions, major diagnostic testing, and burns. Benefits are paid directly to you unless otherwise assigned. Coverage is guaranteed issue, which means you may qualify for coverage without having to answer health questions. Benefits are paid regardless of any other medical insurance. The supplemental plans are not eligible to enroll through ESS. To enroll, you must either call Continental American Insurance Company at the numbers listed above or visit their website at wecareworks.com/wecare and use the login information provided. Employees, covered spouses, and retirees enrolled in the Cigna medical plan are eligible to participate in the wellness program and earn a medical rate discount for their 2022-2023 medical benefits. Here's how you can achieve wellness in 3 easy steps. Step 1. Annual exam. Visit your physician for your annual physical exam by January 31st, 2022 to earn 10%. Obtain your biometric measurements from your annual preventive exam. Your biometric measurements must be labs obtained from February 1st, 2021 or later. You need up-to-date measurements for your blood pressure, total and HDL cholesterol, height, weight, and waist circumference. Step 2. Health assessment. Use your up-to-date measurements to complete the online health assessment at mycigna.com between May 1st, 2021 and March 11th, 2022 to earn 10%. Step 3. Wellness engagement. Complete one of 5 wellness engagement options between March 15th, 2021 and March 11th, 2022 to earn 80%. Complete all these 3 steps to earn 100% credit and you'll earn your discount. For more information about the wellness program, visit HoustonWellnessConnection.org. As a new hire, if your benefits become effective on or after September 1st, 2021, you are exempt from taking the online health assessment and will be eligible for the annual discounted rates automatically. The City of Houston's EAP offers confidential counseling that helps address stress, relationship, and other personal issues that you and your family may face. Our team is staffed with qualified clinicians who will listen to your concerns and can refer you to in-person counseling and other resources to help with anxiety, depression, marital conflicts, problems with family, job pressures, grief and loss, and substance abuse. Additionally, EAP offers several educational seminars throughout the year, including anger management courses, stress management, and more. Through Guidance Resources, EAP can assist with financial information and resources, work-life solutions, legal support and resources, and more. You can contact the EAP at 832-393-6510 or Guidance Resources at 855-377-7485. You can also email the EAP at employeeassistanceprogram@houstontx.gov or visit the Guidance Resource website at guidanceresources.org. The Death Termination Pay Form is separate from life insurance. This form allows you to elect a beneficiary that will receive any pay which you would have otherwise received, like wages, vacation accruals, sick time, and PTO that is owed upon your death as an active employee. Make sure that you do not confuse the 2 forms. The Death Termination Form is your pay and your life insurance is a separate benefit. To complete this form, it must be notarized. You can visit a notary public that is convenient to you, or the Benefits Division has several notaries available at 611 Walker on the 4th floor. If you ever need to reach the Benefits Division, we are conveniently located on the 4th floor of 611 Walker. You can also reach us by emailing benefits@houstontx.gov or calling 832-393-6000. You can also view more benefits information on our website at cityofhoustonbenefits.org.